And I'm the former Kalaji, so Samre Agenda 111 Air President of Ghana, and Nana Addo Dankwa or Bekati Sword Emma or Atwima kwawuma district. Na Agenda 111 wana oka start free ye nti Atwima kwawuma for omudian na yehwe nti hwe video akasi na se won subscribe on so dia subscribe na baka Kalaji echi busia no ho Mr. Shema wana fofo share Samre ya nanado Bekati Sword no we share video nko so we no side nsem bi etudwa o dwumede na se e se ne kosi ye ene ahimfo nso bebre nso e de omanu musem e de tudwa e wo nti Samre awhwen kosoa na share ma wona fofo na muso media e koso my konkron Ghana no Samre ya president Nana Addo Dankwa fufu Addo o kati so na o kati ni say Ochoko blocks in the moon, that is the cutting sword for Agenda 111. Yeah, and so share the quantity, or Kalaji, so subscribe na share my own now for. She video you can see, my bra, only other for me, and as also Kalaji. I think Nanado Okakoshe, the main project or drawing board in the soup. Another Okakoshe, Okosha, Momudia, the Tibada near 9 by the 9, the will be seen near that day. It's Miss Row. So won't subscribe, won't subscribe. The Kalaji politics. This is what is happening on grounds in Ghana, where Atwima kwawuma district, or Ashanti region, kumasi, Atwima kwawuma, one agenda 111 is that Nanado promises say so we see district hospitals or some 111 districts omuni district hospitals agenda 111 Mr. some person will run another project no do almost position land in the soup Mr. Some subscribers subscribe na share my for the ecoso of my concron Ghana. Another some people will say na me gina hono no man or blackboard so subscribe Kalaji channel or ground if focus to be alive Kalaji why should video ni kwesi ya uso ushi ana protection ti misra should video no mani si na we no dey support bi Samre omo protection the way media ni bi si akọ on ground na contractor no na say project manager protection the way media no be sia koso as a hospital no way the highway and no church the president of the Republic of Ghana no church no Mr. subscribe kala gh na baka ibusia no onsa right wo subscribe no me bell no so na share ma wona for share na for so the ecoso my concrete Ghana mu where hospitals are president of Ghana or promises so baby say agenda 111 hospitals at the district via Omomuni district hospitals within the Eastern region of Ghana and Pacho Koswashe videos enche nanado or the Sampobi about Tuja or Jumedinasi enche bedrusu. She video no nanasi the Sampobi about Tuja Sisia and Sautia and also with me actually wabi and I said the Okosuno with the Sia with me a commenting and therefore YouTube and I said the Facebook page now
Chief of Staff at the Office of the President and officials of the presidency, Ashanti Regional Minister, Minister for Health and Member of Parliament for Doma Central, the Minister for Local Government, Decentralization and Rural Development and Member of Parliament for Okre, the Minister for Works and Housing, a Member of Parliament for Bantama, the Deputy Minister for Defense, and Member of Parliament for Atwima, Kwawuma, Members of Parliament, CEOs of state agencies, Nana Echina Kwejan V, the representative of Asante here, Nana Nubi Ufra III, Tredehine, the General Secretary of the New Patriotic Party, Ashanti Regional Chairperson of the New Patriotic Party, residents of Trede, fellow Ghanaians, ladies and gentlemen. I'm the choir cabrofo. When the man why and the idea of Fagan of Afanina, the Yamabiano Bia Chichi, to the choir, man and the potom. Today is a happy day for Mother Ghana, and I'm glad that it is under my tenure as President of the Republic that the biggest ever investment in the nation's health care is being made. We are met this morning because of the ravages of COVID-19, which has affected every country on the planet. For us in Ghana, not only has the pandemic disrupted our daily lives, but it has also exposed the deficiencies of our healthcare system because of years of underinvestment and neglect. Indeed, in update number 8 of the Fellow Ghanaians series, I indicated that COVID-19 has revealed the unequal distribution of healthcare facilities in the country, as we have tended to focus our healthcare infrastructure in Accra, Kumasi, and one or two of our other big cities. As we have seen, epidemics and pandemics, when they emerge, spread to any part, can spread to every part of our country. We discovered that there were 101 districts in the country with no district hospitals, and we had to do something about it. The creation of the new regions also meant the government had to construct 7 regional hospitals for the new regions, including a new one for the Western region. See to the construction of 2 new psychiatric hospitals for the Middle Belt and Northern Belt respectively, and rehabilitate the Afiankwanta Hospital in the Western region. This led to the formulation and declaration of Agenda 111. Following on from this initial announcement, a lot of work is being done to help make this vision a reality. And I'm delighted to be here with you in Trede to cut the sword symbolically for the commencement of construction of these hospitals across the country. So far, 88 out of the 101 sites have been identified, including this one at Trede, the site for the construction of the Atwima Kwawuma District Hospital. Work on the other 87 sites also commenced today. The acquisition of the remaining 13 sites will be completed shortly for work to begin. Each hospital is being constructed at a cost of $16.88 million United States dollars. That is 12.8 million United States dollars for construction and 4 million United States dollars for medical equipment. All the hospitals are to be completed in 18 months. Work will commence on the regional and other hospitals in the latter part of the year. These modern, fully equipped state-of-the-art hospitals will have facilities for outpatient services, including consultation facilities for medical and surgical cases, ophthalmology and dental services, a physiotherapy unit, maternal and child health unit, public health unit, 4 state-of-the-art surgical theaters for maternity, obs and gynae, accident and emergency, and for general surgery and imaging facilities. In addition, each hospital will have the full complement of male, female, pediatric, and isolation wards. Provision has been made for support facilities, which will include a kitchen, laundry, sterilization department, mortuary, energy center, maintenance department, and staff accommodation for doctors, nurses, and other health workers. Ladies and gentlemen, Agenda 111 has been carefully thought through to inspire activity and growth in various sectors of the economy and also help bring jobs to the youth. It is a Ghana First agenda, and the following facts will help make the point. Firstly, a consortium comprising some 20 Ghanaian consulting firms made up of architects, civil, structural, electrical, and mechanical engineers, quantity surveyors, biomedical engineers, and other technical teams have designed these hospitals to reflect our unique domestic requirements, including impact of climate, socio-cultural conditions, and traditional practices. They will also supervise the construction of these hospitals, which will be built by some 250 domestic contractors and maintained by domestic facility management professionals as part of government's policy of developing domestic capability in the building and construction sectors of the economy. This will undoubtedly help retain most of the money in the country to engender further investment in the economy. Secondly, the hospitals are of a standard design and construction to provide a blueprint for speedy and cost-effective implementation of future health infrastructure programs in the country. Thirdly, the execution of Agenda 111 will require significant domestic inputs, which will give impetus to private sector investments into the one district, one factory policy. I expect Ghanaian entrepreneurs to take advantage of the opportunities provided by the significant investment and produce quality building and construction materials required by the hospitals. Fourthly, we have incorporated into this agenda the strategy of direct and indirect job openings to stimulate the economies of the various communities in which the facilities are to be located. These include the creation of an estimated 25,000 jobs during the construction and design phase, i.e., jobs for architects, civil, mechanical, electrical and biomedical engineers, quantity surveyors, masons, carpenters, welders, steel benders, painters, tillers, and related professionals and artisans, as well as other indirect jobs. Once completed, it will provide job opportunities for some 20,000 health professionals, and thus enable the Ministry of Health recruit more doctors, nurses, pharmacists, and other health professionals. In addition to these, there will be many indirect jobs for residents in the local economy. For example, for persons who will sell food, drinks, hospital consumables to the hospital, its staff, patients, and visitors. I am confident that this important investment will have a positive impact on many lives and livelihoods in the respective communities. Ladies and gentlemen, Mananum, beyond the building of these new healthcare facilities, my vision is to help make Ghana the center of excellence for medical care in West Africa by 2030. Leveraging on Ghana's favorable status in the region as the most peaceful country in West Africa.